Hi everybody. So I'm a pathologist. so I'm not very good at marketing or business side of things. Nero, where's Nero? So Nero and I, we actually got together a few years ago. We were actually speaking about something in some other meetings, and Nero was actually wearing clinician's hat, a business hat, and I was not wearing any business hat, so I'm actually not a very good business guy. Anyway, today I'm going to talk to you about Clear and Brilliant Touch, which is a device from Solta Medical. New applications for all skin types. Disclosure, I've received some travel and honorarium. I live in Sydney, so not much of travel honorarium. I'm new to CBT, so I'm not going to pretend I've got a lot of experience with this device. Probably most of you might have actually have more experience about this device than me. So I've got much to learn. Some of the photos and cases of my real patients, and they are actually real cases and real photographs, and they have not been altered. And these are merely my thoughts, and doesn't mean it's universal truth. So a little bit about myself. I'm a dermatopathologist with interest in energy-based devices, and as I may have alluded to you, I did actually undertake ACCS, which is Australian College of Cosmetic Surgery, in medical faculty training many years ago, under supervision of John and other doctors in those early days. And then after that, I became a pathologist. So I've got this background of cosmetic medicine in my belly. So I still see patients, even though I'm a pathologist. I do a lot of skin-related clinical work. I do reporting work as a tissue diagnosis and pathology work. Last week, I diagnosed 2 nodular melanomas and 5 melanoma in situ. So I do a lot of these things. I used to undertake research at Sydney University, and my field was photobiology and vitamin D related subjects. I'm also a qualified electrician, although I'm not practicing as one. Okay, so today I'm going to briefly talk about Clear and Brilliant Touch, some of the literatures that I digged up and read them, and my experiences, and also what I think of future possibilities. Because I'm Asian, I do deal with lots of Asian patients, and Asian skin is supposed to be very difficult. Many of you probably also agree with me, and you don't want to do a lot of laser sessions with Asian patients because their skin can be very temperamental. The reason being is that Asians do have a wide variety of Fitzpatrick skin types. So Asians, not just one skin type, it's broad skin types, ranging from 3 to 5. But I've seen like an Asian patient with skin type very close to type 2. And they're susceptible to a broad range of pigmentary disorders. So treatment in Asian patients, the approaches may be different, and they tend to suffer from higher risk of complications. So when you talk about Asian beauty, a lot of the Asian patients actually do want white skin, and that's hard, especially in Australia. It's funny that a lot of Caucasians actually like tan skin, so that's actually a cultural difference. Talking about devices, Luminous One IPL was my first device I purchased in 2006, I think. So that's actually IPL. That's not a laser device, it's non-coherent light source. And that was actually quite fun to have this device because I was able to customize different pulse profiles, and I was playing with different settings, and I did actually treat a lot of patients with it. But then again, I soon realized that I wasn't actually universally useful for every condition. So I started buying other devices. This is Deca device. Where's Matt? So this is one of my old devices that I bought from Matt. I still have this device. It's a fraction of CO2, smart side. And I keep buying new devices. I keep buying new devices because I feel thirsty. You know, I need to buy one more, and then I haven't mentioned all the devices here, but I keep buying stuff. Where's John? John's telling me that I'm a bad businessman. I clearly think I'm a bad businessman because I don't really think about the money side of things. And my accountant was actually the one who's stopping me to buy stuff. Where's John? You taught me, yeah, you taught me well, but not well enough. So yes, I've got a lot of, some of these actually opened another clinic in Chatswood. So my clinic, main clinic is Crossnest, but I've got another clinic in Chatswood. So I've actually doubled up in some of these devices. So there you go. So out of all these devices, what I believe to be essential in any kind of medical skin clinics is that you need an ablative device, either CO2 or erbium. You need a short pulse laser like Q-switch or picosecond, and these are really basic ones. I think you should really have at least one of these things before you actually start buying other things. So vascular laser, pulse dye, or KTP, long pulse. The rest are actually optional, like long pulse lasers, radio frequency, Ulthera, and these things. Whenever you're actually about to buy a new device, you got to think about a lot of things. Like, do I need it? Do I need it or do I want it? I often try to convince myself I need it when I actually want something. Does it really work? You try to demo it with some patients, and really, for the short period of time, you can't really work out whether it actually works or not. Will I use it much? There are devices that I've purchased over 10 years ago, but I only used like a couple of times, and that's a complete waste of money. So will I use it much? So money, obviously, John mentioned about the money you need to spend to purchase things and the money to maintain it, and then the warranty and service contract, all these things you got to consider. And I find relationship with the distributor to be very important, because you don't want to be left alone once you buy something and you feel like you don't know what to do with it, and the salesperson is actually not quoting you anymore. There are a few other things that I think it's important to consider. It includes well-established treatment protocols. I think it's quite important. Also expected outcomes of such treatment. Because some other lasers, you can sometimes easily make like human errors and over-treat sometimes, or under-treat somebody, and that's not going to lead to patient satisfaction. So I think these established protocols are actually important in terms of reducing complications and providing reliable service. But it really comes down to evidence. These treatments actually have any evidence of providing the result that you're looking for. Every time I purchase a new device, this is like a demand curve. This is like a laser absorption coefficient curve, but I think it's very similar in that when you first purchase something, that it looks like oxyhemoglobin or melanin curve, because the demand is quite big when you actually first purchase anything. And then sooner or later, it will actually drop down within a couple of years, because obviously the early adapters will actually want to try it. They call your clinic and try to book themselves, like the one I bought, one of the devices, CoolSculpt. So when it first came, there was like huge demand for the first few months, and then after that, everything dies down. And then you get more competitions, and all of a sudden you lose patients. And it actually happens like that until I find when the device is reliable and it's actually produced evidence-based results, then it starts climbing back up, like Ulthera. I find Ulthera to be one of these things. So it was actually quite high demand when it came. And then it dropped down, and then later on it started sort of plateauing and actually establishing quite well. So these things you have to actually consider. Okay, so Clear and Brilliant Touch, this nice little device. Now I'm going to talk about this thing, because it was actually first launched in 2011, I heard. And after more than 20 years, this new generation Touch was released in USA a couple of years ago. And there's been nearly 3 million treatments that have been provided until now. So basic history about fractional thermolysis. 2003, that's when the first fractional laser concept was published. And 2004 was when the first fractional device called Fraxel was actually released by Reliant Technologies. And Rox Anderson, you know him very well. He was actually behind this. So fractional lasers actually can be divided into ablative or non-ablative. And now we've got the picosecond lasers. You can actually include light-induced optical breakdown as one of the categories, I guess. Also, fractional radio frequency devices, they're out there, so you can actually include that as well. So I've actually reviewed some of the papers. I'm just captured the titles. So these papers are where I got this information from. just to list them in chronological order. So there has been quite a few publications regarding this device, some old and some new. And just to summarize these things now. So what is Clear and Brilliant Touch? It's a very light version of Fraxel, or Fraxel Dual. It does actually have 1550 and 1972. So they actually made it into a small device of light Fraxel, into this iPad-sized device. So it's a non-ablative fractional diode laser system producing a maximum of 0.9 watt with 1927 nanometers and 2.5 watt with 1440 nanometers, two different wavelengths, which in comparison with Fraxel Dual is actually quite low energy. But they made into small package out of that. It's interesting to look at this beam profile. So when you compare the beam profile of this PAMIA, which is the 1927 nanometer Clear and Brilliant Touch, it actually does give you this oval shape profile rather than just a round circular profile. Okay. So these are the differences between the 1927 thulium lasers. Obviously, 1927 is a wavelength of a thulium laser, but this is actually diode generated, so I can't call this a thulium laser. So the injuries that these lasers create is different in terms of the size and the depth. So 1440 tends to give you a small injury that actually is deeper, and 1927 does give you wider and shallower type of injury. And these are the thermoscopic photos of my own face when I actually had my face treated with these lasers. 1927 actually does give you this oval shape, as you can see. With right in the middle, there's a little dot. Probably implies the highest energy point. While 1440, I think it actually gave me a little smaller but rounded appearance. These are the scabs that were sitting on my face. So one of the literatures actually shared this histology of a Clear and Brilliant Touch. And this is characterized by intact stratum corneum on the outside surface. So you're not actually ablating the skin, but you're actually causing non-ablative energy into the skin. And there's a basal clefting at the basal membrane area, dermal epidermal junction, followed by actually an area of thermal-induced collagen alteration that measures around 150 microns in depth. So that's the characteristic histology of these injuries that you create with this laser. This is a histology of a thulium laser that actually gives you a similar picture, but it actually does give you a deeper penetrative depth, and the surface intact stratum, the skin layer will actually work as biological band-aid, really, to actually for the injury below to actually heal. So this is Fontana-Mason stain that shows the melanin migration after the laser treatment that actually clears this melanin in your epidermis with the microscopic epidermal necrotic zone. So I'm going to skip this. So thulium laser also give you this spectrum, and the histology that was done by another group actually shows a very similar kind of morphology. And this scanning electron microscopy view actually showing this tiny little microscopic lesion that's created by the laser. And also is another electron microscopy view actually shows a tiny little porous holes that is created in stratum corneum that actually increase the permeability in skin without disrupting that layer. So this is the histology, again, of the PAMIA, which is 1927 with Clear and Brilliant Touch. And this is actually histology that I did with carbon dioxide laser. So it's fractional CO2 laser that I was using at 5 watts. And then I sectioned the skin and I created, I mean, obviously I've got this image, which is actually very similar in terms of size and depth of the collagen alteration, except that the top layer, which is actually destroyed with carbon dioxide. So you're not actually getting that intact skin after this laser. So there's big point in difference. When you use a powerful CO2 laser at 30 watts in multiple stacks, you can actually get these impressive holes drilled deep into your sort of mid-dermis, up to 2 millimeters in depth. But this is a very different beast altogether. You don't want that in everyday patients because obviously it's going to create a lot of side effects and downtime, not to mention the pain. What's unique about the Permia is that because it does create this oval-shaped surface injury without altering the surface, but increase the permeability. So you can actually apply topical serums and topical applications to actually improve the permeability and improve the absorption of such things. So this study actually demonstrated that after Permia treatment, the topically applied ascorbic acid at different concentrations were actually as great as 5 times the control. And another study actually showed up to 17 times improved permeability. And clinically, after the patients actually had the Permia treatment, on the left, you can actually see a lady with just the Permia treatment without the ascorbic acid application, which obviously showed improvement in terms of dyschromia and skin textural improvement. But when you actually apply the vitamin C serum on top of it, you can actually expect to see even more improvement in dyschromia and skin texture. A lot of studies actually confirm the patient satisfaction after these treatments. So most patients, after 4 sessions of standard treatments, actually agreed that they're actually very satisfied with the outcome. And as you can see, the outcome can be appreciated over 3 months, probably beyond. There's another study that actually used this laser for treatment of neck and décolleté, so chest area. So improvement in wrinkles, skin texture, and pigmentation was noted. And these were the results, some of the improvements that you can see. So it's quite safe to be used in your neck and your chest area, which is quite common problem here in Australia because we do have a lot of patients who actually present with poikiloderma of civet, and it's very challenging to treat these patients. So we can treat them with V-beams and picosecond lasers and fractional CO2 and Fraxel devices, but these are very expensive and painful. But this may be a simple solution that we can actually provide this treatment for these patients. With severe sun damage in Australia, it might actually be perfect for these patients because it will be very safe and effective. Now, next set of pictures. This was actually thulium laser that a group in Korea, they utilized this to treat severe cystic acne patients. And surprise, surprise, the results actually been quite promising. And these patients, I believe, was not taking any Roaccutane or any oral medications. And the treatment was actually quite different in terms of how they're treating these patients. And I guess the depth of what thulium can achieve is definitely more than what Clear + Brilliant can do. But in terms of how these patients were actually improving at the infundibulum level, at the sebaceous, pilosebaceous units, I think quite possibly Clear + Brilliant touch might actually be able to help these patients with acne sufferers as well. Okay, let's just skip this. Okay, so some of the clinical cases that I've noticed. I haven't had this device for a long time, so I haven't actually had a chance to treat too many patients, and I only treated some of these patients twice rather than 3-4 times. So this is a lady in her mid-40s who had 1 session of standard treatment, which includes 4 passes of Permia and 4 passes of 1440. Basically came back after like a week later, completely healed, showing improvements in skin texture, pores, as well as skin color. This is my clinic receptionist staff, and she actually had this once as well. Standard treatment, and her dyschromia and her skin texture also improved, and she was quite happy with this. Another lady, early 40s, 1 session of CBT, basically also shows somewhat improved skin in terms of color and texture. I would have really treated her nose well, but I actually didn't. So next time I might actually try to concentrate the force on her nose and see if I can actually reduce her pore, I think. So another patient in her early 50s, she's got this very subtle melasma. I think melasma can actually improve quite well with this, even with one session of Clear and Brilliant Touch. So she's also quite happy with the outcome. And I think, yes, she was actually quite happy with this. A gentleman in his 30s, he'd never done any laser in his life ever, and he's about to get married, and he's someone who doesn't actually use sunscreen. So I actually convert him to start using sunscreen regularly, and we provide him with 2 sessions of Clear and Brilliant Touch. And overall, you can actually see his skin whitening effect, and skin actually looks better. His dark circles actually look like it's improved. His periorbital lines look quite remarkably better too. So he looks quite well now. So look at his pores. I think it's quite impressive that his pore and his rough skin can actually look so much better. So this is after 2 sessions of this treatment. And each time we actually did use the SkinCeutical vitamin C serum. This is me. So I did treatment once with the treatment. I did the treatment without the numbing cream, and I just wanted to try it out. It was really painful. It was really painful. I'm not the best patient. I usually don't do any laser on my face, so I was actually very keen to try it out. And I'm quite surprised that I actually got so much sun damage. So anyway, I did one session, and this is me after one, and this is me today. So I look okay. So the pain to me was lasting for maybe an hour or so afterwards. It was actually quite irritating, but after that I actually felt completely fine. I had tiny little brown dots sitting on my face, and the dermoscopy photo that I showed you was actually my cheek. But it all went away within a week. So I thought it was actually quite low downtime. I was able to see my friends and the people the day after, and I was actually looking quite okay. So fairly positive. Okay, so another patient in her mid-50s, some subtle melasma. I guess she does show some improvement with the melasma. At least the melasma is not worse, right? So I haven't had anyone with melasma getting worse with this laser up till now, so yes. So what's with melasma? Melasma is a condition, obviously, it's not really pigmentary condition, but it's supposed to be like an accumulated dermal aging process where lots of cellular processes and senescent fibroblasts actually cause continued increase in melanin pigment production. So you need to actually improve the dermal environment rather than try to chase the pigment. So pigment treatment for melasma, to me, is definitely a waste of time. And Clear and Brilliant Touch is one of these lasers that actually cause the papillary dermal remodeling. So in that sense, I think it has actually a big role in terms of managing melasma patients, because I often don't recommend lasers for patients with melasma. This patient, I actually obviously didn't do any laser. I was actually educating her and give her some topical treatments and sunscreen use instructions, and she actually looks like this in 6 weeks. But in these patients, I think it's probably useful to consider like a recommend Clear and Brilliant Touch, because it does reduce the pigment load in these patients with heavy melasma like this, right? So I think it might actually be a game changer in a way. Yeah, a few hot things these days. Regeneron, everybody knows about it. So I try to treat some melasma patients with Regeneron and also mix with tranexamic acid with some variable results. So possible combined applications, I think, in the future, I could actually probably try to use it in tattoo removal. So it's similar to FracTat technology. I mean, the technique, I don't know whether you guys heard about it, but the fraction laser followed by sort of proper sort of zoom picosecond or Q-switch lasers actually improve the clearance of tattoos. So that can be useful for this. Clear and Brilliant can be useful for tattoos. Solar lentigo, epidermal pigment, sort of pigmentary conditions with dermal implications as well. So you could actually use Permia to actually stack multiple times like this. Oh, sorry, that's my mirror jet. I want to show you the way I stacked with the lentigo. So I haven't had this patient come back yet, but I would like to share her lentigo, because she's got quite a big confluent lentigo or flat sub-K on the cheek. So you can basically stack it many times and use picosecond laser on top of it. So you can actually use this device called MirrorJet, another device, to actually produce improved transepidermal drug delivery after Clean Brilliant Touch to actually enhance the effect. So some of the melasma treatment that I treated as such, just want to share. So this lady had 2 treatments with transepidermal stuff, and she actually showed more significant improvement than the previous patient. I think it's actually going to work well with many other melasma patients. Another lady, quite significant improvement. Surprise, surprise. So I've had some significant improvements in people with very difficult melasma with Clean Brilliant Touch combined with other modalities. So I think the future is that I could try this in more melasma patients and see how successful it is. I'm quietly sort of hopeful that it might actually be one of the best treatments that I can provide for melasma patients. Thank you very much.